And welcome to our afternoon webinar around mental health and termination for medical reasons. This is our third webinar in our series that Jane has graciously delivered to us. And we are glad that it finally worked out. After battling some illnesses, we are here. We have arrived. So my name is Betsy Winter, and I'm the Director of Community Support for Return to Zero Hope, and I want to personally welcome you. Before we begin, I just want to share a little bit about our organization. The mission of Return to Zero Hope is to engage a global community of bereaved parents and their health providers to improve mental health outcomes while also advancing pregnancy and infant loss awareness, education, and support. And at RTZ, we serve bereaved parents through all of our great direct services, our virtual support groups, workshops, in-person retreats, through all of our online resources and education, and by providing resources, trainings, and support to the providers who interface with these parents throughout their journey of love and loss. Today's webinar, like I said, is the second in a three-part series. And it's really been very educational and informative, covering the important topic of terminations for medical reasons in a post-Roe United States. And we recognize the significant and traumatizing impact that politics, law, religion, and culture have on individuals and families needing access to reproductive health care, specifically abortion and terminations for medical reasons. And we are deeply committed to creating spaces and providing resources that honor the diversity of humanity and all the forms of loss that can be experienced. So without further ado, I'm going to introduce Jane. She is a TFMR mom, native Texan, and a clinical social worker certified in perinatal mental health. Following the birth and death of her first child, Frankie, through TFMR, Jane opened Both and Therapy to provide individual therapy and support groups to other TFMR parents. These services aim to provide support to parents through the unique barriers and grief of ending a unwanted pregnancy, particularly in the state of Texas, where such care is no longer accessible. She's passionate about building community, eliminating shame, and honoring grief for TFMR families. And we're really lucky to have you here, and I'm excited to hear the third part of this webinar. Thank you, Jane.
Thank you so much, Betsy. I am excited too. I really feel like I could talk about this stuff all day, every day. So I'm excited to condense some of it into what I hope will be really useful and supportive information for other mental health professionals who are supporting TFMR parents. So for today, this is what we're going to cover. We'll start with talking a little bit about perinatal mental health and TFMR, sort of the interactions of those two things. We'll go into the impact of law and politics, professional ethics and the law, some do's and don'ts of TFMR-informed care, and then we'll share some resources for mental health professionals and clients that will hopefully be useful for folks in their practices. And then we'll save some time at the end for Q&A if anybody who is tuning in live has any questions. We've talked about me already today, and this is the third webinar, so I'm not going to spend too much more time introducing myself. But just to say that this work is really important to me personally and professionally, and I'm really excited to share more with my colleagues in the mental health field today. Okay, so looking at the impact of termination for medical reasons on mental health. According to Postpartum Support International, or PSI, mothers who've experienced termination for medical reasons are at a higher risk for depression and post-traumatic stress disorder. The perinatal period in general, so looking at trying to conceive and becoming pregnant through the first year postpartum is all encapsulated in that perinatal term. But there are marked increases in prevalence of mood and anxiety disorders during pregnancy and postpartum period. And in loss in pregnancy, including TFMR, there is not an exception there. So this is a slide that I shared in one of the other webinars, but I just think it is worth repeating over and over and over again. This is just a reminder that post-loss of any kind still involves that postpartum period. Pregnancy doesn't just stop and the body resets to exactly what it was before pregnancy. So TFMR parents going through their loss may not have an understanding of if, say, their lost pregnancy is their first pregnancy. They may not have support or information shared with them from medical providers or not have it be part of their follow-up care necessarily. So, a body doesn't understand or know why a pregnancy ended. It just knows that it ended. So it goes through the same process, whether or not there's a living baby to care for. This embodied experience can also be a really complex and impactful variable in the grief that TFMR parents experience. And the way it shifts and changes as your body shifts and changes in connection to the loss. So in therapy with TFMR parents, you may need to provide that context for clients to connect what they're experiencing with a typical postpartum experience. So that hormone drop, milk coming in, hair falling out a few months later, things like that, that may feel really disorienting, especially if someone has not had a previous pregnancy experience, or if they have and just haven't connected the dots for themselves yet. Some factors impacting mental health and TFMR parents, and let me start by saying that this is not comprehensive, this list, but just some things to keep in mind as you're working with these families. So starting off with that physical, hormonal, mental, and emotional shifts related to that postpartum period. The silence surrounding reproductive loss of any kind and stigma associated particularly with abortion comes up a lot for TFMR parents. Already there are not many social scripts for when a baby dies, so silence is a really common response to folks who are grieving pregnancy and infant loss. A lot of misunderstandings about the process of grief, and certainly in the West, we might have a lot of this concept of moving on that may or may not feel connected or relevant to folks in grief. And then, of course, layers and layers of stigma, whether it is connected to the way someone's pregnancy ended, so whether it was labor and delivery or surgical termination, whether or not somebody had to travel out of state because of laws that are fueled by anti-abortion stigma. That silence and stigma can be really, really isolating for these parents, and maybe a really large factor in impacting their mental health. We touched on it, but those legal barriers that include everything from narrow or non-existent exceptions to abortion bans, lots of law that feels designed to intimidate and frighten people, either from accessing care or from knowing who they can trust when they are trying to access that care. Lack of social support, and risk of harm associated with attempts to access that support. So if somebody has, let's say, family and friends they're really, really close with, and who they have a history of being there for each other through hard things. What happens when one of those people who is central to someone's support network maybe is not supportive of ending a pregnancy for any reason, or maybe they want to be supportive and they don't know how, so they fumble a lot or accidentally say hurtful things. It can really kick up a lot of fear of judgment, and lead to a lot of secondary losses related to the changes in interpersonal relationships. So some friendships may not survive through a TFMR experience. Relationships may change. It may not be as close as it once was, or there may be disappointment that folks aren't able to show up for that grieving parent the way they would wish or the way they need. Guilt, shame, and sense of responsibility for the loss. These tend to feature really heavily in my work with clients and can be uniquely intense for TFMR parents. I wouldn't say any of these is necessarily exclusive to termination for medical reasons. Folks who've experienced other kinds of reproductive loss absolutely express feelings of shame or guilt, sense of responsibility. And for TFMR parents who had to sign consent for either procedures or other medical process for ending a pregnancy, that agency in the ending of the pregnancy can sometimes cause a lot of dissonance and discomfort inside of a really complex grief experience as well. And then certainly trauma and grief. Trauma can show up in a lot of different ways, of course, in any clients accessing mental health care. The trauma may be related to the medical care they received or wanted to receive and were unable to access. This can be related to traveling out of state to an unfamiliar place, having their procedure take place with a doctor or medical team that they do not know, delays in accessing care related to arranging travel or wait lists that may be longer than they were a couple of years ago due to so many states outlawing abortion. So their limbo period in between deciding to end the pregnancy and actually ending it may be extended, causing trauma to the client. And grief, again, in this grief illiterate society we exist in, it's very difficult for someone to go into the process of grief understanding what they may be undertaking. So while grief itself is not a pathology, it can be distressing for clients who may not know what to expect, or I hear a lot clients say things like, it feels like I will never get out of this deep, dark place. And what does that mean for the rest of my life if this grief is going to stay with me? So that could be major factors showing up there as well. I just want to touch briefly on those fears of judgment as well. These are some examples of comments and judgments that TFMR parents face online, among friends and family, and even within their own minds and the way that they speak to or about themselves. Just reading through some of these examples, consider the impact that hearing this, whether it's from somebody close to you or a stranger online, the ways that can impact someone's mental health, their self-image, their sense of security. These comments all of these are things that have been said to TFMR parents. Some maybe have had fewer interactions like this than others, or have lots of great support that minimizes the impact of judgments or comments like these. And no grieving parent wants to feel as if they are being demonized or misunderstood, or judged in their grief and in their loss. Since we touched on grief not being a pathology, I do want to just quickly address prolonged grief disorder, which, if you're not familiar, it's a newer diagnosis that was added into the DSM, representing, quote, a prolonged maladaptive grief reaction that can be diagnosed only after at least 12 months or 6 months in children and adolescents have elapsed since the death of someone close. Diagnosis is a complicated issue to begin with. As with anything in the DSM and just about any mental health diagnosis, there are pros and cons and a number of variables to take into account. But just some things to consider with this diagnosis being in the DSM, it opens up the opportunity to research it, develop effective treatment, and connect someone to health insurance coverage for that treatment. And some of the description in the criteria, et cetera, may seem to folks who are familiar with working in grief like it could be pathologizing a very normal and natural response to really stressful loss situations. So just consider in your work what makes the most sense to you. But I do recommend just checking out this particular diagnosis in the DSM, especially if you're more used to working with diagnoses like depression or anxiety or adjustment disorders, things like that. All right, we're going to move into some of the impact of law and politics for mental health professionals. Take a drink. All right. So, as I'm so fond of saying, I'm not an attorney, and nothing in this presentation should be misconstrued as legal advice. These are just some considerations when we're looking at the ways that law and politics impact the mental health of parents going through termination for medical reasons. So, right there at the top, we have intimidation and isolation. Laws that criminalize healthcare and criminalize supporting someone accessing that healthcare can instill lots of confusion, fear, and subpar healthcare. Some examples of this, I have a wealth of examples to share from my home state of Texas. So here in 2021, even before the Dobbs decision and the reversal of Roe v. Wade, there was Texas Senate Bill 8, SB 8. We're also seeing now city and county ordinances popping up all over the place, banning people from helping folks to travel in order to get a legal abortion out of state, or traveling through using the roads in that county or city. in order to access care. Both of those, well, one at the state level and the other at county and city levels, use the same mechanism for enforcement, which is lawsuits filed by private citizens. So part of how SB 8 was able to slide through under the radar and stay in effect even before Roe v. Wade was reversed, which at the time it was blatantly in conflict with the precedent set by Roe v. Wade. But since it was not enforced by the state, it was enforced by civil litigation. That was the workaround. So the same is true for these laws trying to restrict travel through, for example, Lubbock County, which is relatively close to New Mexico, where lots and lots of folks from Texas who need abortions will travel to, including TFMR parents. That is designed specifically to frighten people. If there is restriction, even things that are likely unconstitutional, like restricting someone's travel within a country where they are a citizen, and a patchwork landscape of ever shifting abortion law, that confusion, that fear, and those harmful barriers to accessing care, even in states where it's legal. So that fear can come up even if you know where you're going is legal, but you may worry, what if somebody sees us and wonders if we traveled to access abortion care and they sue us? What do we do in that case? Can we risk that? So that intimidation and isolation can have a really intense impact on TFMR parents and their mental health. This also leads to interference with what licensed healthcare professionals say to clients or patients. So for mental health professionals, as well as medical professionals, it can be unclear what may or may not be safe or legal to share with clients. This may have different impact for different clinicians depending on the state, county, or city in which you and your client live, the state or states in which you're licensed, and at what point in the client's experience they get connected to a therapist. So, for example, things may shift if you're connected with that client from the time of a diagnosis and supporting them through decision making and accessing abortion care. Or it may be different if they're coming to you after the fact and reflecting on that experience and the impact it's having on their mental health. Again, that confusion, that fear, it reduces the quality of care, and it inserts really destructive mistrust into what is typically a really protected and important relationship between therapist and client. Then we come down to the trauma associated with accessing healthcare that is criminalized. So I invite you just to consider the vulnerability of a client seeking therapy as they're going through a TFMR or following their TFMR, particularly if they're navigating these really complex, really restrictive legal barriers that are not medically informed at all and very politically motivated. The message to those clients inside of that experience can be that they, along with anyone else who needs abortions, are criminals, bad parents, that they are a murderer, that they are selfish, that they don't deserve compassion and support, that they do not deserve to grieve, and thinking about the impact that can have on someone's self-worth, self-compassion, their self-concept, and the way they interact with or do not interact with their grief. I also want to bring in, this has been in the news a lot recently following the Alabama Supreme Court ruling that defined embryos as, extrauterine children, and is now impacting in vitro fertilization in the state of Alabama and possibly others soon. So the impact of these laws reaches far beyond abortion care. And this is something that reproductive rights advocates and reproductive justice advocates have been saying for years now. But we're looking at the ways these laws are being applied to fertility treatments. So all kinds of assisted reproductive technology, including in vitro, including surrogacy, including fertility treatments for same-sex couples, etc. There are fears about contraception also being impacted, and that runs the gamut from, pills, IUDs, condoms, everything, and lots of unintended consequences. Some of these consequences may be very, very intentional. And some of what you might be seeing in the news in the aftermath of the decision by Alabama's Supreme Court is politicians who are racing to kind of step back a bit from the impact on IVF. The other thing I want you to think about in terms of TFMR inside of this full spectrum of reproductive health care is that TFMR is not an isolated experience from that full spectrum. There are lots of TFMR parents who ended a pregnancy with a pregnancy that was made possible by IVF or IUI, or they may have, been through years of fertility treatments. There are even instances, though extremely rare, of parents who went through pre-implantation genetic testing as part of their IVF protocol, only to discover that once that embryo was developing into a fetus, and they're going through their typical prenatal care, they may discover that there is in fact a chromosomal abnormality, even though, again, the odds of that are so low. I want to say something like 1% or less, that those pre-implantation genetic tests are 99% accurate. But just imagine the feeling that some of these TFMR parents and IVF parents in Alabama may be feeling, watching so much of their experience be criminalized, made inaccessible, and sometimes willfully misunderstood and wielded as a weapon for the political agenda of their elected leaders. So yes, thinking about how these other issues, these other elements along the spectrum of reproductive health care are impacting your clients, and also considering how these issues may be impacting you, both as a clinician who is prioritizing and valuing the confidentiality and the needs of your clients, but also as a person. Lots of us who operate in perinatal mental health spaces do so because of our own experiences. whether that's our own experiences of loss or perinatal mood and anxiety disorders, etc., there can be some overlap in the impact on our clients and the impact on us. So really looking at what does it mean for us to share in the impact of these laws with our clients, and how can we both support them and care for ourselves inside of that. Okay, we're going to talk a little bit about professional ethics and the law. I'm still not an attorney, hasn't happened yet. But we'll just have a look at some of the considerations that may come up when you've got your clinician, your therapist hat on, and you're looking through what you need to be doing or how to approach these questions when there's an ethical issue in your work with clients. So first things first, codes of ethics do not provide answers. They guide the decision-making process, helping you determine an answer. This can be really frustrating when there are very concrete potential consequences on the legal side of things, and it can sometimes feel mysterious or uncertain how your ethics are guiding you in your decision-making process. I like to invite folks just to think about the last time you went in and actually read your profession's code of ethics. Maybe you're a supervisor and that's something you're doing with supervisees all the time, or that's just the way you operate. And I'm willing to bet there are folks out there that that's not a document they revisit very often. So let this be your invitation to go back to that code of ethics and really reading through it through this lens of the current legal and political landscape and the ways that you may want to either steel yourself or clarify for yourself the ways that you are supporting your clients in an ethical way. Documentation. This is one that comes up a lot in presentations I do, that folks are express a lot of stress about how to document, what to document, how to limit risk and liability, etc. So of course there are high level considerations like HIPAA compliance, things like that. Sometimes folks have talked about some separation between the medical record versus psychotherapy notes. So maybe you have a progress note and a psychotherapy note, and the psychotherapy note may or may not be something that would be immediately relevant in the progress note, but maybe it's something that for the work that you're doing feels important to capture. In working with or speaking with some folks from the National Association of Social Workers here in Texas, I was advised that that delineation between progress notes and psychotherapy notes may or may not be as safe as you may think. If a subpoena were to be handed over and asking for your records with a particular client, that may include psychotherapy notes. So that's maybe not the safeguard that one might wish or think. I do like to talk with folks about knowledge possessed versus knowledge documented. Just because you know something about a client doesn't mean it needs to go into their file or their progress note for that session. There's also ways to give some distance in the language that you use in your documentation. So when folks ask questions about, well, if somebody is pregnant or they were pregnant, or they're going through fertility treatment, whatever it is. And that is, some of the content of the work that we're doing. How can I document in a way that is both accurate and not overly descriptive in a way that may introduce some risk? So this is usually where I remind folks that pregnancy is a medical condition. And oftentimes, if I am in doubt, that is the language I will use. So it can be something like, developing coping skills in preparation for upcoming medical procedure. That could run the gamut of possibility. And it is both vague and accurate. If that procedure is a D&E to end a pregnancy, if that procedure is an embryo transfer, it is not necessary that those exact words be in the note, and it can help just to shift into that mindset of pregnancy as a medical condition. You also want to consider in documentation who may have access. So this may be impacted by whether or not you are in network with any insurance providers, or if you provide super bills, even if you're out of network. I also encourage you to think about how you can support your clients' informed consent about what they share with you and how it may or may not be documented in their records from their treatment with you. So particularly if you work with primarily perinatal mental health, or even if just your clients are of reproductive age and have a uterus, in the current landscape in this post-Roe United States, that may be something just to add into your intake process, talking about what you may document or why, getting clarity and opportunity to clients to ask questions, and making sure that you understand your approach as well, so that you can inform your clients in the clearest and most supportive way possible. And then we also need to consider legal risk. So ethics and law do not always line up neatly in a way that fits together very clearly. So consider what level of risk feels approachable, comfortable even, and know that this will be unique for each individual, depending on so many factors. I know for myself, opening my practice and being very public about working with TFMR parents in Texas, I had a conversation with my husband to talk through, what level of risk are we comfortable with, recognizing that outside of my control, somebody could think maybe that I had supported somebody to access an abortion in Texas when it was illegal, and bring forward a civil lawsuit against me. While I don't think that is likely, because I don't believe that I am the intended target for those laws, it's still out there. So it was important for me and for my family to discuss that in those direct terms and say, what level of risk feels appropriate, and also to make a plan for if that worst case scenario happened, what resources would I turn to for support? And we are going to get into some resources to share with y'all to help you outfit yourselves in that way as well. Professional speech. is also an important consideration in this question of ethics and law. Professional speech is not codified or protected in any federal or state law, and there's no heightened protection for it under the First Amendment. In part, this is why some states previously, in efforts to restrict access to abortion care, enacted laws requiring specific language, or often it might have been referred to as counseling, to be said aloud or provided in writing to patients getting abortions that were not medically accurate. For example, from my own experience, I was in Texas. My loss was in February 2021. So this was pre-SB 8, pre-Dobbs. Still Texas, but there was much more access then than there is now. A nurse had to read aloud a paragraph that was legally required and contained information that was not true. The clinic was absolutely professional about the way they handled that. They went right through that paragraph and then stepped back with me and were able to say, these are the things in that paragraph that are not true, invite questions and the like. But this question of, that confidentiality between therapist and client, or doctor and patient, and what is said in those interactions does not have extra protection under the Constitution or in any federal or state law. Client-centered care. So really considering the possible barriers or obstructions to client-centered care in advance, and seeking consultation on managing those competing priorities. That's often where ethical dilemmas pop up, is where two different sort of values or principles are maybe at odds with each other inside of that particular clinical issue. But again, considering this in advance and not waiting until somebody is in your office or logged on to telehealth and in session with you to be thinking about this stuff for the first time. So consider the number of outside variables at play in each situation, and centering the client's care and their needs in those considerations. This is the best way to both protect your client and yourself, so that you're not on the spot or approaching something without a strategy in mind. And then no discussion of ethics would be complete without encouraging folks to seek out clinical consultation and supervision whenever necessary. If there is either somebody that you are already connected to, or somebody who is an expert in a particular area of mental health care, or of different ethical dilemmas, go out there, get that consultation, that supervision, and then document that you did. The same goes, I would say, for any legal advice. If you're feeling out of your depth and needing the insight of an attorney, get it and write it down that you did. There's possibly no more important thing than making sure that you have some checks and balances and some insight from somebody a little further from the situation to help guide your process and your thinking. All right. So as we are nearing the end, I'm going to share some do's and don'ts of TFMR informed care. and then we'll be getting into some of those resources I mentioned earlier. So starting with our do's, there's lots of these. Some of the themes you'll see in here include inviting clients to talk about their babies or their loss experiences, their birth experiences. Many lost parents are not given the opportunity very often to tell the story of their pregnancy or their birth or loss. It can really mean a whole lot to TFMR parents and lost parents to hear their baby's name or nickname spoken aloud, particularly if it's unprompted. If you just make a note of this is how they refer to baby, or making note of important dates so that you can acknowledge them or consider them in your work with that client. Some of those dates might be their loss anniversary or birthday, depending on how they, the language they use to describe it, their due date, dates connected to when they first received a poor diagnosis or the first kind of hint of bad news. Language they use to describe their baby. Do they say baby, fetus, child, son, daughter, use a name or nickname, etc.? How do they describe their birth experience? Do they identify with termination for medical reasons or TFMR? Do they identify with abortion, birth, procedure, surgery? Making note of the language that they use to define their experience and mirroring that back to them. And that can both build trust and rapport with your clients and avoid inadvertent harm. For example, the word abortion horrifies some TFMR parents. I would say particularly those early in their grief. It's very common to really shrink from that word because it feels so counter to the ways that they feel about their loss experiences, based on all of that internalized narrative that is politically motivated. I've heard so many TFMR parents say that one of the most impactful things anyone has done for them was to not only call them a mom or a parent, but to say that they were a good mom or a good parent for the way they handled their pregnancy and their loss. That doubt or that overwhelming sense of responsibility for ending a pregnancy can be really overwhelming, and sometimes folks imagine or sense that they are not allowed or shouldn't be allowed to grieve or identify with anything that labels them as a mom or a parent, particularly if they do not already have living children. Let's see, you can read some of these other ones yourselves, but another thing just to consider is that TFMR parents are not always offered the same options or resources connected to memory making with their baby that some other lost parents may be offered. Again, if they've never been pregnant or given birth before, there's maybe a lot of mystery around what that process looks like and how they can participate in it or not. So taking the pressure off for that memory making to look a certain way or take place at a certain time, remain consistent. It can be really helpful to provide some options and give some context from which the client can pick out what feels like might be a fit for them. Okay, onto some don'ts of TFMR informed care. A big one would be, do not make your clients guess whether or not you are a TFMR ally. Wherever you're out there advertising, particularly if you do work with perinatal mental health and the perinatal period, please include termination for medical reasons and other kinds of reproductive loss in your website copy, in your flyers, in your social media. We really want to thoughtfully call in these parents who are bereaved and overwhelmed and potentially afraid to seek support. Um, Definitely want to avoid rushing them through their grief or expectations to, quote, move on. I usually reframe this with my clients from moving on to moving forward with their grief in a way that feels, if not good, feels better. The more they are able to work on it, the more they're able to try out and learn. I certainly, if you are connecting with clients who are in that in-between period or who get a devastating diagnosis while working with you, do not leave them without extra support in that limbo period between diagnosis and their TFMR. Many parents describe that time period as the most distressing. And it can be really important to outfit our clients with coping strategies, information, helping them advocate for themselves, particularly if they're going to be traveling out of state to an unfamiliar city with unfamiliar doctors. Really preparing them to go into that experience as well resourced as possible can be really crucial in their healing afterwards. And then certainly avoiding any or enabling the avoidance of any big or, quote, negative emotions such as anger. You will be building that relationship with your client and noticing what they lean into, what they shrink away from, where they're really comfortable going, where they're uncomfortable going. And with termination for medical reasons, anger can be really common. It can feel like rage, it can feel like jealousy. Shame is certainly another one that may not be, there's very few people who are just chomping at the bit to talk about things that make them feel ashamed of themselves. And for TFMR parents, those emotions may be where some of the really important work is. So make sure that you are supporting them in engaging with those emotions and processing them. Okay, as we get to the end here, I'm going to take us through some resources that I think mental health professionals who work with TFMR parents, or just people who work with people who can become pregnant should know about. I love the Guttmacher Institute. They have this interactive map that can show you in this very color-coded way level of restriction on abortion in different parts of the country. They also have breakdowns by state that talk about what is or isn't legal, what is or isn't restricted in each state. They also have some demographics information. They also have different sections on demographics of abortion seekers and a section about insurance. Again, using my home state of Texas, there are laws on the books in Texas that prevent public and private health insurance policies from covering abortion care. So it can be important to know what the law says where you are and what it says in federal legislation versus state legislation, if there's been any shift, but particularly for folks who are accessing care and are insured, that can bring up a lot of unexpected financial distress. If, When, How is another fabulous organization. Their tagline is lawyering for reproductive justice. They have some great resources on their website, including, as you see here, the Repro Legal Defense Fund, which is for folks who need funding for bail or legal fees for criminal, family, or immigration defense. That defense fund is also there for folks representing someone who's been criminalized for abortion or their pregnancy outcome. And then the Repro Legal Helpline, which provides free confidential legal services, particularly for pregnant folks. So you can see here it talks about, have the police contacted you about a pregnancy outcome? Are you being denied life-saving abortion care? Do you need a lawyer? That's a resource that you can reach out to. They also have this fantastic PDF document. There's a link there at the bottom of the slide that is all about mental health care after Dobbs from lawyers, because folks have questions about this stuff. I just picked out 3 of the questions and answers that I was most excited to see on this document. So there's an abortion ban in my state. Can I still talk to my patients about abortion and miscarriage? They also have one that says, I want to be able to refer my patient for safe abortion and miscarriage care. Are there legal risks? And lastly, my all-time favorite one, because this is in the language in Texas law, what about states with laws that attempt to make it a crime to, quote, aid and abet an abortion? Does a referral make me an accomplice to the crime of providing abortion care in a state that bans abortion? And let me just remove any suspense. You cannot aid and abet a legal action. So if they're accessing care where it is legal, you've aided and abetted no crime. The Turnaway study also has some great information in it. This is a really expansive study looking at the harms of denying people who need or want abortions, and the implications that go well beyond that individual's experience. There are some of the same resources here that I covered earlier, as well as a few others. If you're watching this webinar and you work with TFMR parents, or you want to get yourself on the TFMR therapist directory there in the bottom left, there's also the pro-choice therapist directory. That QR code will take you to my website if you're looking for other TFMR specific or inclusive resources. And I'm always happy to consult with folks who are looking for something, or needing to talk through some of that clinical and ethical concerns we talked about before. I know we're running out of time, but if there are folks who are logged in live who have questions, I'm happy to take some questions. And otherwise, just really excited to have participated and done these webinars, and really grateful to RTZ Hope for putting them on and giving me this platform. So thank you so much. And yeah, if folks have questions, hop in.
Yes, please. If you have questions, I think chat is open. You can go ahead and do that. Or I believe you might even be able to raise a hand. I could possibly call unmute you if you wanted to use your voice. And Jane, while that's happening, I just want to thank you so much, and also express how just incredible I think you are in the work you do.
Oh,
yeah,
thank you.
Like so necessary, and I learn something every time I sit down and participate in these, and I know that it's making me a better support for the TFMR families and anyone who's really looking for reproductive health in our country. So thank you so much.
Yeah, thank you.